Hello everyone, welcome to my channel Bone Doctor. Today I am going to discuss a very important topic of diabetic foot. Why it is important? As you know, India is the diabetic capital of the world and there are most number of diabetic patients than anywhere in the world. So many people suffering from diabetes has the highest chance of suffering from diabetic foot. Why diabetic foot is so important? Diabetic foot is one of the leading causes of lower limb amputations in our country. Yes, it is much more than accidents, it is much more than any other cause in the world. So let us understand what is diabetic foot. Whenever a person suffers from diabetes for a long period of time, especially uncontrolled diabetes, that person's foot suffers from neurogenic problems. That is, they lose sensation of their feet. There is loss of blood supply to that feet. That leads to infection of the foot and that leads to gangrene and ultimately amputations. Awareness about diabetic foot is well established in the Western world, but in India and Southeast Asian region, people are not even aware of diabetes. Many people suffer from uncontrolled, undetected diabetes for years. And even if these people have diagnosed themselves as diabetes, they do not control their blood sugar or check their blood sugar levels regularly, leading to diabetic foot. So let us now understand what or how does diabetic foot occur. We know whenever a person suffers from chronic uncontrolled diabetes for a long period of time, long means 5 years, 10 years, 15 years, 20 years, the blood vessels of the person becomes very thick. That is, the person has peripheral vascular diseases. Peripheral blood supply to all the organs decreases. As we know that diabetes causes retinopathy, diabetes causes other problems. So diabetes essentially affects the nerves, that is the blood supply to the fine nerves of the hands and the foot are affected. Thus the nerves are badly damaged, especially of the hands and the foot. This is termed as peripheral neuropathy. When this peripheral neuropathy sets in, the person who is suffering from diabetes loses sense in the foot and the hands. This is known as gloves and stocking distribution of neuropathy. As a person loses sensation of their foot and hands, these persons lose pain sensation also in these areas. As we know that whenever we walk, we encounter certain obstacles, we may hit a stone or we may have a stone in our shoe. Common persons who have normal sensation of the foot immediately detects the problem and immediately removes the stone, or if he has got hit, he stops, he checks that area and then takes rest. But in a diabetic individual, as the complete loss of sensation of the foot has occurred, that person doesn't get any sensation of pain in his foot. So a cut in his foot or an injury to the foot or even a fracture in the foot goes undetected by that person, and that person goes on walking with that fracture or with that cut injury for days on end. This causes ulcer and damage to the bones and the joint of the foot. This is also accentuated by the fact that the person is also suffering from peripheral vascular disease, that is atherosclerosis sets in the blood vessels. What is atherosclerosis? Atherosclerosis is whenever you suffer from a diabetes for a long period of time, the blood vessel walls thicken and it thickens up so much that it impedes the blood supply to the limbs. We know that the blood supply to the lower limbs is already at the lowest point. If 80% of the blood reaches the brain, a very small percent, 1 or 2% of the blood goes to the foot. So imagine that amount of blood is also not reaching the foot. So the foot suffers from ischemia, that is the muscles, the skins, the ligaments, the joints, they all suffer from ischemia, that is loss of blood supply to the foot. Combining these two effects, that is neuropathy and loss of blood supply to the foot, causes huge ulcers in the diabetic foot. But irony is that the diabetic person is completely unaware of such a huge ulcer, and even with this ulcer he can walk around as he has no pain in the foot. These ulcers gradually increase in size and they catch up an infection. We know that diabetic patients are chronically compromised and immunocompromised, and their ability to fight with any infection is very low. So once infection sets in such a ulcer, the case is completely out of hands. So these persons need very urgent medical attention by multimodal doctors. There should be a physician who should control the diabetes. There should be a physiotherapist, a physical medicine doctor who will guide him how to deal with these ulcers. There should be a plastic surgeon, there should be an orthopedic surgeon, and multimodal treatment is required to heal these tough ulcers which keeps on growing, and in most of the cases it goes out of hand and the bones are infected and osteomyelitis sets in, and which leads to amputation of that person's limb. Amputation is a very sad outcome of diabetic foot. So it is our wholehearted effort to stop amputations at all cost, because amputation means loss of job for a person, loss of earning member for a particular family. So diabetic foot needs to be dealt very seriously and awareness needs to build up. So this is why I made this video. Hope you liked the video. If you like it, please give it a thumbs up and share the video. In subsequent coming videos, I will be discussing about the symptoms of a diabetic foot, means how can you detect a diabetic foot early if you are a patient of diabetes, and what are the treatment modules of a diabetic foot. So keep watching my channel, subscribe my channel, take care, stay well, stay healthy.